The Safe Care Partnership launched in March 2022 and its first phase ran for around 2 years until May 2024. The partnership aimed to accelerate the pace and scale of patient safety improvements on a national level across NHS Wales. It brought health boards and trusts together with Improvement Cymru and IHI, the Institute for Healthcare Improvement, combining local knowledge, national support and international expertise to improve the quality and safety of care across Wales. Across its 4 key areas, the partnership was grounded in IHI's framework for safe, reliable and effective care, which sets out the interconnected elements across culture, learning systems and leadership required for improvement to thrive. The Leading for Patient Safety component was designed to develop patient safety expertise within a network of senior leaders. And as a network, those leaders shared and learnt together and became sponsors for patient safety within their organisations. Coaching for Patient Safety sought to develop a cohort of coaching experts from colleagues across NHS Wales who had a grounding in improvement. They supported teams, executives and senior leaders for safety in the delivery of improvement within the partnership. And then along with IHI, we undertook foundational site visits to the health boards and trusts participating in the Safe Care Partnership. We spent time with individuals, teams and departments to learn about their challenges and achievements, to understand their culture, learning systems and leadership, and to identify the support they needed with patient safety improvement. Those 3 phases fed into the Safe Care Collaborative, which over 18 months saw 37 teams across NHS Wales deliver projects to prevent deterioration within community, ambulatory and acute work streams. This work was underpinned by a leadership workstream that supported the adoption of the organisational learning systems, culture and working environments required for improvement to succeed. Over the course of the Collaborative's learning sessions, coaching calls, tailored support, we saw teams deliver excellent work, resulting in tangible successes within their organisations, including a significant reduction in cardiac arrests among patients with complex surgical needs on a ward in an Aneurin Bevan University Health Board, an increase in fluid balance chart compliance from 10% to 90% in Hywel University Health Board, reduction in non-injurious falls conveyance from domiciliary care providers in the Swansea area, and Betsy Cadwaladr and Cardiff Reveil University Health Boards collaborating to establish call for concern services. In addition to these successes, the first 2 years of the Safe Care Partnership also surfaced deep learning through formal evaluation, activity, feedback from participants and our own reflections. And within the NHS Wales Executive, we're applying all of our learning from the first phase of the Safe Care Partnership into what comes next, which we've been co-designing with colleagues and public contributors to put quality at the centre of healthcare across NHS Wales.